All right, grid rules.
Grid
Let's
rules.
just jump right into it. So I'll get a little bit more specific, but first off, what are grid rules? I guess what's the deal with being over 50 versus under 50?
Right, there are no grid rules for folks who are 49 and younger, or if their impairment is mental.
Mm-hmm.
Um, the grid rules only apply to exertional levels, which are physical levels. There's sedentary exertional level, there's light exertional level, and there's medium. And I'd talk about heavy, but it just doesn't matter because it doesn't really apply in the grid rules. But Social Security, way back before you and I cared about, Social Security
Yeah.
law, um, they correctly said that when you hit 50, your employability chances they start diminishing.
Like adaptability.
Sure. Yeah. Being able to just jump in to work, um, and what the grid rules do is every 5 years. So 50 through 54-year-olds are on one grid. 55 through 59-year-olds are on another grid, and then 60-year-olds to retirement age are on the other grid. And what the grid rules do is they say at certain exertional levels, if you're this age already and you can't do your past work, that is crucial. It is the number one
Right.
determining factor of where the grid or whether or not the grid rules even apply. Because if you can do your past work, the grid rules don't apply. We find this mostly with office type workers. Hey, I'm 58 years old, and my doctor said that I'm limited to sedentary work, and Social Security agreed with my doctor that I'm limited to sedentary work. And you did office work
Yeah.
all of your life.
And that's what you've been doing. Yeah.
And so you can do, probably, you can do that past work. The grids won't apply. The grids are only for if you can't do your past work. And what they are is, they're called the grids in a very slang type of way with Social Security. They're actually the medical vocational rules.
Okay.
And the medical vocational rules, but they call them a grid. They call them the grids because it looks like a grid. It's like, okay, well, this person has this education and they're this old and they can't do their past work, and a finding of not disabled is appropriate, or a finding of disabled is appropriate, and they're literally just columns like you'd see on an Excel spreadsheet. Yep. It's the grids, and the grids go by exertional level. So the 201, that's the CFR, it's Social Security law. Yep. But the 201 grid starts with sedentary, and then the 202 is light work, and then the 203 is medium work. And then the 204 you would think is heavy work, but no, the 204 is kind of just the broad definition of why there is the grids. A lot of people erroneously hear on the website, or on the World Wide Web, on the internet, that, well, I'm 49 or I'm younger, and therefore there's no point in me applying. And I win tons of younger individuals. They're not on the grids. They're all lumped into what they call an inability to perform sustained work. There's a Social Security ruling that has to do with that. Probably the best ruling that Social Security ever came with, because they don't do a whole lot of rulings that favor the disabled. In fact, in the last 15 years, I can't think of a Social Security ruling that was actually good for the disabled. But this Social Security ruling, this SSR, it's 96-8P if you're wondering. It basically defines sustained work and says if you can't do sustained work, if you can't work 8 hours a day, 40 hours a week, because of your conditions, Social Security has to find you disabled, which you would think is duh, but it's not. I mean, it's you kind of have to walk through, jump through those hoops.
Yeah.
But that is the foundation of the grids. I am not going to sit here and tell you that it's not easier to argue a case and thus possibly win a case on a 58-year-old who probably is on the grid than a 38-year-old who, their grid just doesn't apply to somebody that young. But it is untrue that, there's just no point in me even applying. And you see that a lot on the internet that, if you're 50 and over, Okay, well, what about the 49 and youngers? Because that's a lot. That's 18-year-olds all the way up to 49. What are they going to do?
Yeah.
I think in the first year I practiced, I tried to sign one client a week. It's just me. I didn't have any staff or anything like that at the time, and I did. But I think the first year that I practiced, 80% of the cases that I won were 49 or younger.
So no grids.
Yeah, no grids. Yeah. I mean, you can make a really strong case that a good case is a good case is a good case. It's just, the grids do make it easier to argue the case. But, the last thing that you would want is somebody on the internet saying, one, I'm not even going to apply because I'm 46. Yeah. And then another horrible thing would be somebody on the internet, I'm 56 and I'm going to get approved like that.
Yeah. Don't hire a rep. You'll get it. Yeah.
Yeah. That's not.
You'll get it in 2 weeks. It's like,
exactly.
That's just not how it works.
Yeah.
Yeah.
Well, Aunt Betty said that she did it. But now the grids are a tool that it's a good law, but it's just a tool to help sort out a person that's 50 or over. It shouldn't be an automatic, hey, I'm going to meet the grids, because sometimes you don't meet the grids.
Yep.
And to kind of go a little bit deeper into the weeds, the work that you did, and Social Security, recent law changed to where they usually want 15 years, but now the recent law is like they only want the last 5 years that you worked, and that's the last 5 years from the time that you're applying or the time you said you became disabled. So if you describe your past work and you literally did a job that was medium, like a forklift operator, construction worker, sometimes construction worker, drywall worker, it's heavy, you're lifting, hundreds of pounds. It is always in your best interest for the grids that your past work is more heavy exertionally, not necessarily heavy for Social Security's definition, but I'm lifting more weight on my feet,
more walking, more bending, right. Stuff like that. Yeah,
more exertionally taxing is what I should say. It's more beneficial to you because that's going to make it a lot easier for you to actually be on the grids as a 50-year-old or older. Mm-hmm. Whereas, like I said, an office worker who's performed sedentary work, sit-down job, for most of their career, and in the last 5 years, which would be what Social Security is interested in, it's real hard to grid. You can't grid if you can do your past work. Yeah. So you always want to make sure that you describe your past work as you did it. And that a lot of my peeps in the hearing, they kind of hung up on that. Well, the judge needs to know that I can't do that. No. When you're talking about your past work, it's how you performed it. If you did, the job of a cashier, you're on your feet most of the day, but you got to tell Social Security, were you able to use a stool for, a couple hours a day? If that's the way it is, then that actually, has to be in your description of your past work. You don't want to describe your past work. Hey, I got problems with my back or I have problems with my knees. And there's no way that I could do that now.
Yeah, because that's not what they're asking.
Yeah, and so you describe your past work. It's like, I have back problems. And past work in the past. Describe it as you did it, and you will shoot yourself in the foot if you describe it. Well, if I'll describe it how I think I could do it now if I tried to with my bad back or my bad knees.
Yep.
No,
that's just a misconception of what they're actually asking you.
They're asking you how you did it. And just describe it honestly. Likewise, education. Education plays into the grid. Somebody with a limited education, and that's defined by Social Security as basically somebody with 11th grade education or less. Mm-hmm. You didn't go and get your GED. You didn't get a high school diploma. That helps you on the grids because you're less employable if you don't have
Sure.
a high school education. But if you do have one, or you have a college education, that's all lumped into high school or better. And that's on the grids too, but you can still win cases with high school.
Either way, yeah.
And then the last thing is probably the most complicated that I want to talk to you about, or kind of answer your short question with a long answer, is transferability. No reason to go deep into the weeds on this, other than the fact that you have to know that the grids only apply if the work that you did not have transferable skills. The grids will only apply to an allowance. Because if you picked up skills doing something that's light, like a cashier, some other kind of job that's semi-skilled or skilled, and it transfers to sedentary, she can't do light, but she could do sedentary work, and she has these skills that they transfer, you'll still get denied. And that's on the grids. So you have your age, you have your exertional level, you have your education, and then you have transferability. Do they have transferable skills? Keep in mind also that there are no transferable skills in unskilled work, obviously. Fast food jobs are usually unskilled work. You can learn them very quickly. And that helps you because you're not going to have transferable skills when you're not picking up skills from unskilled work.
Could you pretty much call unskilled work like an entry-level job?
Sure. And that's what it is. And Social Security, if they're going to put you back to other work, it's always entry level. Because think of that. It's almost impossible for you to walk into a skilled job.
Sure.
And then, one of the big things in Social Security and the arguments that a good representative would make is if there are limitations that you have, if you have, the need to, take a couple extra breaks during the day, or, you have like PTSD or ADD or ADHD, and you need to, you just need a couple minutes outside the normal breaks that you would take, just a few minutes to kind of collect myself, to do my breathing skills or do my coping skills or something else. If you have to be accommodated like that, that is usually something that an employer will allow if you're coming into a skilled job. This person has skills, and I'll let them do these kinds of things.
Yeah.
But an unskilled job, you cannot walk into an unskilled job and say, well, I'm going to need a few extra minutes to collect myself because I have this problem, or I'm going to need some breaks, or I got a horrible back problem, I need to prop up my feet for a few minutes at a time. Can I do that for, a couple, 3 times a day? No, not in an unskilled job, you can't.
Right.
You can't walk in there and expect some employer to allow you to do those kinds of things. And we'll argue that if a vocational witness is foolish enough to testify that you can do that, a good rep will say, no, let's think about that.
Right.
Usually we won't, never are we just outright rude about it. But it's like, are you really telling the judge that somebody could walk into an entry-level job and start dictating to their employer what they can and cannot do?
Yeah. That's just not how it works.
Yeah.
Okay. Yeah, so a lot to unpack here. I think that it's really important for clients to understand this, because it seems when we're talking about grid rules, and we're calling them grid rules, and we're talking about Social Security rulings, it's easy for us to kind of get derailed into, like, we're losing the audience as we're talking about certain Social Security vocabulary stuff. So just to kind of recap, if you're under the age of 50, and I'm going to oversimplify this and you can kind of correct me along the way. So if you're under the age of 50 and you're applying for disability, you're pretty much you're saying that you're unable to work, period. That is essentially what you're doing. Right?
Exactly.
And in order to get an approval, you have to have the medical evidence that shows that you are unable to work, period.
Correct.
Once you get to the age of 50, they're a little bit more lenient with how they define disability. It's not necessarily that you have to be unable to perform any kind of work. It's just that you have to be limited in the kind of work that you were doing prior, correct?
Right. You can't be able to perform your past work, and then you have to have an exertional limitation that would be on the grids.
And that's 50 to 54, and then you turn 55 and they get a little bit more lenient.
Yeah, the 50 to 54 grid rule, because that's the first 5-year period. Sedentary work is what you're looking for, or sedentary limitations, because it's the biggest limitation. If you're limited to sedentary work, that's pretty much the least exertional thing. It's a sit-down job.
Yeah.
You know.
If you can't do that, that's
exactly. So that's for the 50 to 54 group. 55 to 59 group, it goes up to light, and light is actually, you're on your feet pretty much all day long, but you're not doing a whole lot of lifting, carrying 20 pounds occasionally, and 10 pounds, throughout. Cashiers are light work, things like that. Some light stocking jobs. A convenience clerk would be a light job. And then if you're 60 and over, that's when now even a medium exertional restriction could mean an allowance. Medium work is the forklift operator, truck driver. Even though truck driver you think is a sit-down job, that's not the way that it's.
Pretty physical, yeah.
Very physical, yeah. You're using your feet, all the time. You're shifting all the time. But forklift, truck driver, some painters, construction painters. Of course, construction painters could also be a heavy job if you're lifting, gargantuan 5-gallon buckets of paint and stuff like that. But that is basically the grids. 50 to 54 is sedentary usually, 55 to 59 light usually,
right,
and then 60 to 64 medium. You don't see a lot of those. Well, you don't see a lot of medium assessments, especially from an administrative law judge. You see them at the lower levels, and the judges roll their eyes at that, and so do I.
Yeah.
But yeah, usually people are going to be limited to light work or sedentary work, and so.
Yeah, that makes sense.
Yeah.
So, okay, I'm going to give you a couple of examples.
All right.
Say someone is 45 years old, because this is probably where most people are. Like their first moment that they start thinking about disability is they have any kind of health problem at all while they're working. They're still working, but they have a health problem, and then they get it in their mind, like, I wonder if I would qualify for disability. Or right when they stop working, I wonder if I would qualify for disability. So, for example, say a 45-year-old is working a construction job, and then it gets to the point where they have arthritis in both of their knees. It's really bad. They have no problem at all using their hands, though, and they can do sedentary work. And maybe I get them on the phone and I ask them if they can do sedentary work, and they just flat out tell me yes, they can. Probably not a case that we can help with, right?
Right, and that's also one of those rare times I would tell somebody, don't waste your time applying. If you're 45 and you can do a sit-down job,
right?
You aren't disabled. Under the meaning of the law. It's one of the questions that I ask in a hearing of my younger individuals. After I've asked them about lifting, carrying, standing, walking, concentrating, staying on task, household chores, I'll say, well, I'll ask you one more question. And this is, you got a job that you hear about from one of your friends. You go into an air-conditioned inside office. You sit down all day long. You don't have to be on your feet. They strap on a headset. And you're kind of a telemarketer. Call comes in, you read from a script.
Yeah.
You don't have to do any thinking. You're basically, call comes in. Hi, my name is Carl, and thanks for calling about the widget. And the widget's the most incredible product on planet Earth. And it does this and it does that. Would you like to purchase one? Talk to a salesman. And if they say yes, you click the button and the call goes to a salesman. And if they say no, well, thank you for calling. If you change your mind, give us a call back. And you're reading all this from a script. And then you click a button and then the call's disconnected. And that's your job. Can you do that job? Unfortunately, I've had that some of my clients all the way to the hearings. Like,
that sounds great.
Yeah, I guess I could do that.
Where do I apply? It sounds like
So and we lose those cases if you do that. But kudos to you for telling the truth. But
I appreciate your honesty.
We would probably
we
screen
just
that. Yeah, exactly. We would probably screen that out way before that.
Yeah.
Do you think you could do a sit-down job?
Yep.
Yeah, I guess I could. I don't think I can help you then because I can't make an argument that you're disabled when you basically just told me you're not.
Okay. So example 1, 45-year-old likely doesn't qualify if they're willing to, if they're able to do some kind of other work, and they're even admitting that, yeah, I could do some other kind of other work.
Yep.
Same scenario, same condition, arthritis in both knees, but they're 55 years old. They can use their hands. They don't have any trouble using their hands, writing, gripping, typing. But they say, I've never done anything like that. I've done construction all my life. I don't know. That would probably be a case we can help them with, right?
Absolutely.
Yeah.
That would be a GRIDS case. Yeah. If their knee problems are so much that they can't be on their feet for very long, that will limit you to sedentary work,
Mm-hmm.
and you're on the grid. I mean, so
Yep.
absolutely. You just have to make the argument. The big thing is medical records. The medical records show that the arthritis is so bad in their knees that they can't be on their feet for very long. If it does, yeah, it's a really good case, and we can make a really strong argument.
Yeah, okay. So another thing that we're saying all this, we're talking about people in their 40s versus people in their 50s. I think it's important to make this distinction because I see this all the time because my feed is Social Security ads because I'm looking at that kind of stuff, so I see the ads all the time. And it seems like it's a little bit misleading, or I don't even know if it's in the ads, but people seem to come to this conclusion, or they have this idea of disability to where it's like, if you're under 50, the approval rate is 0. And then if you're over 50 or you're over 60, the approval rate is 100%.
Yeah.
Right?
Yeah.
And so I want to be very clear, the way that approval rates work by age bracket, it's not like, 0% and then you automatically qualify. It's you're in your 40s, you are more likely to get denied and then have to appeal it to the hearing level. You turn 50, it goes up. You turn 55, it goes up again. 60, goes up again. But it's incremental. It's not like if you're 30 or you're 40, even if you have all this stuff wrong with you, don't even apply, don't waste your time. That's not how it is,
Right, exactly. Last year, in the fall of last year, I had 2 cases within a month of each other, 62-year-olds.
Mm-hmm.
Neither one of them had performed job work that was sedentary, and the lower levels denied them both. And so I took them in front of a judge. And the first one I lost. I'm like, she's 62 years old. Well, the second one, I kind of was expecting, are you going to pull that again? Because it was the same judge.
Same judge,
which rarely ever happens. But this one was the same judge, same vocational witness too. And so I had a little bit more ammunition on the second one, and I won it. And then I appealed the first one, basically on the same reason, and we won that. We found out we won that one like 3 weeks ago.
Oh, nice.
But the fact of the matter is, to answer your question, these were 62-year-olds who had been denied at the initial level and denied at the reconsideration level. And one of them got denied in my first hearing.
Even at the hearing level, yeah.
We won it on appeal, but so it happens, that it's just a fallacy that, you're over 50, you're in like Flynn. Just like it's a fallacy, well, you're 49 or younger, there's no point in even trying. Like I said earlier, first year I won just a tremendous amount of, I think I won a 21-year-old, like in the third case I ever won. Yeah. It's like she was 21. I was like, okay, but she had some very severe psychological problems. Medical records showed it. She was credible. She basically told the truth, and we won that one. But yeah, so it's just a fallacy. In the age of the internet, it's kind of like, we want to operate in that this is always the way it is, or this is always the way it is, and that's just, with disability, it doesn't work that way. I mean, there are great, like I said earlier, a good case is a good case is a good case. You're 35 years old, you have MS, your doctors are basically, she's going through these cycles, and when she's got an exacerbation, she's literally bedridden. How frequently does that happen? That's probably 4 or 5 months out of the year. That woman's not employable. That's a great case. Medical records show that. Yeah. Okay. Yeah. So it's a great case. And no reasonable judge if it has to make it to a judge, it probably would get a lot of the lower levels it should. But even if made to a judge, the judge is going to be like, yeah, this this person cannot work as work is defined. And that SSR is talking about 96-8P. It's sustained 8 hours a day, 40 hours a week.
Yeah, and we're very straightforward with clients. Like the first time we talk to them, like if anyone's wondering if they apply or not, or if they qualify or not, if they just call in, if they schedule an appointment and I'm talking to them, if they don't qualify, I'll let them know. If it's a 42-year-old, I'll go over kind of what we just talked about, a simplified version of what we just talked about, and I'll let them know, we're not going to waste your time, and you just, according to Social Security's laws, you just don't qualify.
Right.
And then I tell them, if it gets worse, God forbid, if it gets worse, if it gets to the point where you don't even think you could do sedentary work, maybe you try to do sedentary work and then you can't hold the job because of that, then we can help you out.
Yeah, because these work attempts that are failed, when they're documented, they're wonderful, potent pieces of proof.
Yeah, because it's
that you can make in front of Social Security.
Because it's not opinionated.
Yeah, it's like, okay, she tried to work this job, and it was a sedentary job. She's sitting down all day long, and she still couldn't do it. Okay, that certainly
pretty telling. Yeah,
helps the case. Yeah.
Cool. Let's talk a little bit about medical source statements while we're talking, because of our policy under 50. Why don't we kind of go over that while we're talking about grid rules and everything with like getting an MSS at the hearing level?
Okay. Yeah, medical source statements. The company policy is, we will certainly take your case if it's a good case. It's a good case. It's a good case. We'll take it at the initial level, and we will appeal it to the reconsideration level. Whether or not we take it to the hearing level, if you're 49 and younger without a medical source statement, that's where it gets a little bit squirrely.
Yeah.
It's not a hard and fast, black and white, carved in stone rule, but it's extremely important for us to make, pretty powerful attempts with you, the claimant, to get with your doctor, your provider, your therapist, and say, hey, I'm going through this process, and my representative says that they need an opinion. A medical source statement, there are several kinds of them. We use one that we created, but we created it literally on Social Security's, which Social Security's, just a little bit more cumbersome, but ours is kind of a streamlined version of that. And then it's got a few more questions. We're really interested for the doctor or the therapist or the provider. How long have these limitations been going on? We want to know about that and stuff like that. So they're extremely important, and they're important because think about it. Medical records are paramount, of paramount importance to your case. That is what helps us prove disability. However, if your medical records just show that you have this and you have that and you have that, and most of the limitations that you've alleged, is the symptoms, are coming from the forms that you filled out.
Yeah.
Which is usually what happens. You don't see a lot of symptomology in medical records. You see the diagnoses. Yeah, she's got rheumatoid arthritis, and you're looking for, what's the range of motion in her left knee? And not in there. Well, what's her pain level? Sometimes they'll have a pain level in there, but a lot of times they won't. She's been prescribed this methotrexate. Does she have any side effects from it? You don't see that in the medical records, and so the claimant is left to fill all that stuff out. But if you send a medical source statement, it covers all of that. Okay, mm-hmm. Lifting, carrying, standing, walking, stooping, using your arms and hands. What's the pain level like? Is the pain would the pain interfere with their concentration? A little bit of the time, some of the time, a lot of the time. Mm-hmm. Did they have any problems with fatigue? Did they have, is their condition such that they would be expected to miss work days? If so, how many? 2 work days a month, 3 work days a month.
Yeah, right.
So a medical source statement will ask all that. I prefer personally, medical source statements are industry-wide. But industry-wide, a representative, whether they're an attorney or an advocate, they're gonna ask for opinion evidence because it's so strong. Personally, I prefer a narrative, which is just a letter. Usually I'm like, I'll ask the doctor, just give me, your treatment history with this person, and what do you think that the maximum exertional level that they could do, and I'll give them Social Security's definitions of the exertional levels, and that's a wonderful. I love it a whole lot better than a medical source statement where they're 20 pounds, 10 pounds, 6 hours,
To have an actual
2
letter.
hours. Yeah, and they circle all that stuff, and then we Social Security does the same thing, but we give them a little, pre-printed lines, please put in here what supports your opinions. And the doctors, sometimes they'll put something in there. Most of the time, they won't put anything, or they'll say, see medical records.
Yeah, it's like the medical records.
Okay, well, all right. But that's why I like a narrative, because a narrative is basically very specific. You're not circling any values. But narratives are even harder to get than the medical source statement.
Oh, really?
Because the medical source statement, it comes to you, and you can
Just a form. Yeah.
Doctor can do it's 2 pages. Doctor can do it. And ours is 2 pages. Social Security's I think is 4, but they can do it in 5 minutes.
Yeah.
And another thing is, I always like in the few times, especially when I first started practicing, that I talked to doctors about this. Some of them, and in my area, when I first started my practice, it wasn't as widespread as it now is. Pretty much where I live, and so I would meet with several doctors at our local hospital, and I have 10 clients who see you, and you have said no 10 times to my medical source statement request. Why? And they always said the same thing: don't want to get involved. What do you mean you don't want to get involved? Well, I cannot afford to be subpoenaed and come to disability court.
Right.
And I'm like, it's never going to happen.
Yeah.
0 times. Been doing this for 34 years. When I was working for Social Security Disability, I never heard of that happening 1 time. And now that I've had my private practice for 21 years, not 1 time has a doctor ever been required to show up and support their assessment. Now, that might happen on personal injury, and I think it does. It just gives us, which makes it a problem for us and Social Security Disability. But I think workers' comp and personal injury, that they do have to come in and testify, that they get subpoenaed, and they lose a half day of work. And when you're making $10,000 a day at a doctor's office, you're losing $5,000 of that. Yeah, or more. They just don't want to do it. So I explained to them, this is your opinion. You will not get subpoenaed.
Yeah, you're
you're
good.
That's your opinion.
Yeah.
And the adjudicator, usually a judge, is either going to accept it or they're going to not accept it, and that's as far as it will go. And I had some success, like I said early on, when I was meeting with these doctors in my local area. But now that we're so far spread, we call them up and give them that spiel, or we'll do it on the cover letter. You're not going to be called to support your decision. The judge is going to either find it supported, or they're going to say, no, this opinion is not supported.
Yeah, and that's the medical source statement is for all cases. Ideally, every case would have a medical source statement, right? At the hearing level, if we have a 60-year-old, ideally we still have a medical source statement. What I generally tell clients is, if they're 45 years old or whatever, under 50, any age under 50, first I'm asking them about the grid rule stuff, and I'm not telling them what it is, but I'm asking them questions like, do you think you're going to be able to go back to work? No, not what I was used to doing. Do you think you could do sedentary work, sedentary job? First I work that out, and they say no. It's like, okay, we're probably going to help this person, but then I'll ask them if they have a doctor that would support their case, just because it seems like we can win a case without a medical source statement, but if they're under 50 and they don't have a medical source statement, it's harder. Sure. And it's not impossible, but it's harder. And that's the main distinction that I'm trying to make with age categories and medical source statement and education stuff. It's a matter of harder and easier No Social Security case is easy, period.
Right.
And none of them are impossible unless you technically don't qualify. But yeah, that's generally what I tell clients that are under 50 is, do you have a doctor that would support your case? Like if we need them to fill out a form, kind of going over your impairments.
Yeah. The way it's exactly right, and it's not just us. You would see it from the representative community at large, or one of the first questions they're going to ask, or if they're hiring a lead company, because a lot of larger firms use lead companies. That has become just one of the. I think there's usually like 7 to 10 questions that they pre-screen you on. That question: do you have a doctor that will support your case? And if they say no, there's a lot of, that's it. I mean, never mind. Don't want that case.
Yeah.
The doctor, if your own doctor's not going to support you, how are we going to be able to make that argument?
That's tough. Or you just don't have a doctor, then that's.
But what I like to explain to my clients, especially if we're at the hearing level, and they're struggling getting that medical source statement.
Yeah.
Well, my doctor, I don't think that he wants to do that. I've talked to him about it, but he's just wondering why we need it and stuff like that. And I'll tell my claimant, I said, next time you have a doctor's appointment with this guy, tell him that we're dealing with a lawyer. A judge is a lawyer. And the lawyer can read medical records, and the lawyer can make decisions, and a judge is given broad authority to make all kinds of decisions. But as a representative, if I am arguing a case, and I'm arguing this medical record, which is pretty supportive, and this medical record, which is pretty supportive, and then this medical record, which is not very supportive at all,
Yeah.
I can make that argument, and I'll do the best I can. Have all that stuff that I just mentioned, and add a medical source statement that says this person, could lift no more than 5 pounds. This person could not be on their feet for more than 2 hours. Couldn't sit for more than 2 hours. Boom! Already, this person's incapable of full-time employment.
Yeah.
You can only sit and stand 2 hours and sit 2 hours. 4 hours does not make an 8-hour workday as defined by Social Security. I can make a great argument with that.
Yeah.
And the judge / lawyer, he's a lawyer, he's not a doctor. He is going to be able to reject that opinion if the medical records support rejecting it, but he's going to have a hard time doing it because he is not a medical expert. It's really difficult for Social Security to justify throwing out a doctor's opinion,
Right.
Because I'm the decision maker. So I just throw out the doctor's opinion. Okay, well, this doctor's been seeing my client for 15 years.
Yeah. I think he knows what he's talking about.
Good luck with that standing up to any appeal. And of course, I would, I'd write that appeal the day that I got the denial. If I could do it. So that's why a medical source statement is a medical record. It is considered as a medical record, and it's treated as such. So just like medical evidence, the records that cover the last 3 years, 150 pages of that. All right, you have that, but if you have a medical source statement also, it basically just puts everything in a box, ties a beautiful red ribbon on it, and hands it to the adjudicator, usually a judge, but sometimes at the lower levels it'll be the claims examiners. But the same thing. I mean, claims examiners aren't even lawyers, so now you have, these people like me, I have a bachelor's degree, therefore I was able to get into disability, but I didn't have a pedigree to be able to say that this doctor who's seen his patient for 15 years. I don't think his opinions, never mind. That just doesn't stand up. I mean, it doesn't stand up at the lower levels, and it doesn't stand up at the hearing level either.
Yeah, nice. Well, I think that pretty much wraps it up. So if you're over 50 and you're unable to work, you might qualify for disability. If you're under 50 and you're unable to work, you also might qualify for disability, but it will be harder.
Right.
Yeah.
Yeah, making the argument would be harder. You don't have as much law. The grids are a really strong, claimant-friendly law. But you still have some pretty good law with
Yeah.
the SSR 96-8P
And-
for if you're 49 and younger.
And also, this is a big deal too. And I ran into this with a client about a month ago or a couple weeks ago. He had gotten his VA benefits with an attorney or some kind of VA advocate, and he's 45 years old. He stopped working like a year or two ago, and the VA representative, he asked them after he won his VA case, he asked the representative, basically, can you help me with Social Security disability? And the representative basically told him that he should wait until he's 50 because it's it's just a waste of time if you're under 50. And I'm looking at that and I'm like, okay, not only is that wrong, if this guy waits until he's 50, he doesn't even qualify because his date last insured is going to be 5 years after he stops working. Yeah. So not only is this false, but like that's just sabotage.
It's damaging. Yeah. It's, I think a lawyer in that situation, if they were called on it, they would be saying, well, we were just trying to give some harmless advice.
Sure.
Nothing harmless about telling somebody to disqualify himself.
Yeah.
With the DLI, you should know that you have your 5-year window, and you're asking a 45-year-old, well, wait till you're 50. First of all, you wait till you're 50. The first question that I would ask you, and I'm a good guy.
Yeah.
First question I would ask you, if you're disabled 5 years ago, why are you waiting until now? Well,
exactly.
VA attorney told me to wait till I was 50, which is going to go nowhere. It'd go nowhere with a judge because essentially the way Social Security looks at these things is a disabled person who believes they're disabled is going to apply for disability. You and I know that's not always the case. There are extenuating circumstances, but it's a good argument. If you're
it's a good reason to apply.
Yeah, if you were so disabled, in 2021, why are you waiting till 25? And you can give a good reason, but there's not many good reasons.
Yeah.
I mean,
if you think you qualify, because there's no harm in talking to someone. Like if you schedule an appointment with us, or you call a lawyer, or you just go apply on Social Security's website, you're not losing anything just by seeing if you.
I tell people that all the time. It's because, and they're usually people who are over 50 that come to us, and they're like, I've been out of work now for 6 months. I didn't want to apply, but I've tried to work at a couple places, and they fired me because I just couldn't do it. Should I wait? No, go ahead.
Yeah.
But I still want to try to work. You're my favorite client already. Okay, apply. And let's say that, we talked about this in one of our earlier podcasts.
Yeah.
All right, apply for disability, and you've had some hard times, before you applied, and after you apply, you get to a certain level. You've even appealed, once or twice. You might even be at the hearing level, but you land a job, and it's a perfect fit, and your boss is great, and your body is not barking at you every night, and you can do it. And what do? You just withdraw your application.
No problem.
No harm, no foul. Your retirement benefits are not screwed up. A disability case in the future is not screwed up.
Yep.
It's just no harm, no foul.
Really, that's the best case scenario. You find something you can do. Yeah.
Exactly. I always tell all my clients, if you go back to work, you're not hurting my feelings, telling me that we don't have a case anymore. I'm going to congratulate you. Absolutely. That is, that's everybody won there.
Yep.
That's what, believe it or not, that's what Social Security wants. They want to approve you for benefits so you can get some health coverage to get better, give you some, money while you're paying bills, waiting to get better, and then off you go back to work. I mean, that's, unless you're of advanced age, that's what they're expecting.
Yeah, right.
And I think it's a reasonable expectation.
Cool. All right. Well, that's a wrap.